Hi, it's Ashlyn Smith, PA and founder of Elm Endocrinology and Lifestyle Medicine in Arizona, back to talk with you about screening for type 1 diabetes. Up to 62% of newly diagnosed patients with clinical T1D without prior screening had DKA at diagnosis, meaning they were already at stage 3, experiencing a life-threatening complication. This is often a traumatic and unsafe entry into an already complex disease. And don't get me wrong, especially with kids, type 1 diabetes can move fast, but screening can help us get ahead of it for some of our patients. Let's talk about who to evaluate and when. So who are we screening? Though we know that the majority of cases of T1D occur without a family history, right now there isn't a recommendation to screen the general public. We start by identifying those at risk, including people with family members who have type 1 diabetes, those who have other autoimmune diseases that are comorbid with type 1 diabetes, and people who self-refer. Screening can be started at 2 years of age and should be started as young as possible. However, if an individual is not screened around this optimal age, screening should still be considered in all youth and adults with a genetic risk. Once we have identified individuals who are at risk, it's time to get them screened. I think there's a misperception that screening is difficult or expensive, but we have several options that we can offer to our patients. Patients can either be tested using a blood draw through a commercial lab or using an at-home kit that requires a finger stick. Some patients may be eligible for screening through clinical research, such as TrialNet. You know, the other day I suggested to one of my patients with type 1 diabetes that he consider asking his family to get screened. His family lives far from a testing center, so he was very hesitant to ask them to travel so far to get screened. When I shared information about at-home testing kits, his entire perspective on screening changed, and he was willing to talk to them about screening options. I think being able to offer a variety of testing options to our patients and their families can really make a difference in catching type 1 diabetes early. Once your patient's blood test is complete, interpreting the results is relatively straightforward. You know from our last video that to have a diagnosis of type 1 diabetes, even preclinically, the patient has to have a positive test for at least 2 autoantibodies. If their antibody tests are negative, the next steps depend a bit on the patient. If it is a child with no personal or family history of autoimmune disease, screening should be repeated at any age if symptoms of hyperglycemia present. Additionally, if the child was screened negative between the ages of 2 to 6 years old, rescreening around age 10 is recommended. If you have a pediatric patient with personal or family history of autoimmune disease, screening should be repeated every 1 to 3 years until age 18 based on their risk factors. And if the patient is an adult, no additional screening is required, but data is limited in this population. If the test is positive for one autoantibody, next steps are also patient-dependent. Consult with an expert in preclinical T1D or a trial center about your patient's individualized next steps. The big question for a lot of us is what to do if we get a positive result with 2 or more autoantibodies detected. The next step is to assess for abnormal glucose to stage the type 1 diabetes, educate our patients, and monitor for progression to the next stage of disease. A specialist can help to individualize assessment and monitoring for dysglycemia, including oral glucose tolerance tests, using continuous glucose monitoring, or testing for hemoglobin A1C. So it is ideal to consult or refer to a local endocrine provider or trial center as quickly as possible after a positive screening. If the patient is eligible, we would also discuss therapy options. More on this in our next video. It's very important to note that we would provide the patient with education and a means to monitor glucose so that they can be on the lookout for signs, symptoms, and glucose elevations that signal disease progression. You can find resources for both you and your patient in a variety of places like Breakthrough T1D and AAPA's Type 1 Diabetes Toolkit. In our next video, we'll dive into how to treat patients with type 1 diabetes and share a bit more about patient education and support. See you there.